Hi, I'm Kimberly Sales-Allers, author of The Big Letdown, journalist, mom, infant health advocate, and I'm super excited to be here today talking with the amazing Deanna DeRihe. Deanna has been a ridiculous presence in the Latina health space. Deanna was the architect of all of the Kellogg Foundation's work around breastfeeding, creating an amazing and how many billion-dollar portfolio?
A few billion, about 12 or 18.
Just a few. So we have so much respect for Deanna and the work that she's done and work that she continues to do around Latinas and maternal health and infant health. So I'm excited to be here today to talk with her about a few things. Deanna is perfectly ideally situated to talk about these issues. She is now the National Director of Health Initiatives for Urban Strategies, and is also working at the Center for
Latina and Family Health Research at the University of Houston.
That's right, great. So today we're going to talk to Deanna about, what does the big letdown look like for Latina families? Like, how is that manifesting itself on Latina women and children?
So I think the biggest thing when we talk about, we don't have all day to talk about this, but the biggest thing we have to deal with is that people think they understand Latinas. Urban Strategies conducted a large survey with the Latino Best Start survey to ask Latinos about their breastfeeding experiences. And we did focus groups, and we did surveys, and we talked to physicians, medical personnel, and then we talked to community members, moms, dads. And what we found is we have this set of things that either people think they understand Latinas, and that Latinas all breastfeed, and they all have healthy babies, or that Latinas are poor, and they're not going to breastfeed, they're going to get supplementation, and they're going to just do what they're going to do. The issue is we're getting the same result, that no one is talking to Latinas.
Wow.
No one's asking about their experiences, and they're assuming they're one big thing. Latinas represent people from almost or over 28 different countries of origin and immigration status, and traveling, their status in the United States, but also how they got here. Were they refugees? Were they political asylees? Like, what their different status was. Have they been here first generation, second generation? Are they newly arrived? So all of those have an effect on our health outcomes, on what happens to us as mothers, but what happens to our children as well.
Yeah. And I think that whole monolithic approach, kind of grouping them all the same, which often happens in communities of color, has become really dangerous. It feels like it's the right thing to do, but it's actually not.
And not just in the communities, but the data, right? You know that policy and programming is data driven. So when we take a group like Latinas and just collect all the data and say one thing about them, it doesn't really serve the larger population. And the feds actually, unfortunately, don't disaggregate this data when they do policy analysis. They say Latinas have this and Latinas have that, and that's the end of it. And so when people say Latinas have great birth outcomes and they all breastfeed, it does us a disservice by not understanding our individual stories and also not being able to serve those communities in need.
Right. So, given that landscape, what do we need to do from a policy perspective or a social-cultural perspective to help kind of change the landscape?
We need to start talking about it. Latinas as women of color need to be part of this idea of what's going on with birth outcomes. If we continue to ignore them, about 1 in 4 births are to Latina moms, right? The Latinos in general in the U.S. are a rather young population. 25 is about their median age, their average median age, and what that means is there are going to be a lot more babies coming up. So if we continue to say things, make these overarching statements that they are fine, and not understand the differences, we're not going to be able to get ahead of it. We're not going to be able to do that prevention. We're going to find ourselves down the road going, what happened?
Right.
What happened to our economy? What happened to health outcomes? What happened to our population? So we need to understand and be part of the dialogue and communication. We need to be part of the conversation. And we need to start looking at and analyzing and synthesizing disaggregated data. Now that sounds messy because there's so many different groups, but if you really want to solve the problem, we need to do something different than we've always been doing.
We got to be radical in our solutions. I'm all for that. So what can we do? What can those of us who care about this issue, who care about, serving all communities, those of us who care about making sure that the burden of the big letdown doesn't continue to disproportionately fall on certain people as opposed to others, what can we do?
We do exactly what you and I have always done. We start having the conversation and asking where our sisters are around the table. Is there someone there, and not just one representative, like are we talking about the diversity of it? Are we part of the conversations? And when we're not at the table, as all women of color need to do, is remind us that we're in a sisterhood and that we need to be at that conversation. We also need to press our policy makers to look at disaggregated numbers. We need to ask the CDC to release information and analyze and synthesize things about Latinas as subgroups so that we know more about what their birth outcomes are and what they need as individuals.
Right. We have to kind of disrupt this pattern of looking at all of them as the same.
Exactly.
And really try to understand how the groups differ, right?
And we need to understand that women of color in this environment where they'll tear us apart and make us pick sides, I've always believed, and we've always worked together as a sisterhood of women of color, and knowing that we're varied. Latinas the same way. We have our Afro-Caribbean sisters, we have our Asian sisters. So Latinas represent all races. Latinas are ethnicity, and it's this overarching thing that doesn't make us all the same. It binds us, but it should be something that we look to support each other, not to find separation.
So we are our sister's keeper.
We are?
We definitely are. So thank you so much, Deanna, for having this brief chat with me today. I'm super excited. You know, we're both really passionate about ending disparities in breastfeeding and in maternal health and infant health, and having these conversations are a great starting point. So we invite you to continue these conversations. Please get in touch with Deanna. If you want to learn more, please tell us what's the best way for us to find you.
You can go to our website, Latino Best Start, or urbanstrategies.us, and you can reach out to us. We're happy to talk to you. And this is the beginning of the conversation, so please don't think this is the end or that I covered everything. There's many parts of this, but this is the beginning.
This is just the beginning, and we have to start somewhere. So we hope you enjoyed this important start, and enjoy the rest of your day.
Have a great day.
Thanks.